Welcome to today's press briefing. We have with us 4 speakers. They are from the Center for Health Protection, Dr. Edwin Choi, Controller of the CHP, Dr. Chang Shok-kwan, Head of the Communicable Disease Branch, Dr. Chen Hong, Head of the Infection Control Branch of the CHP, and Dr. Lau Ka-hin, Chief Manager of the Hospital Authority. We'll first hear from Dr. Choi. Good afternoon, everyone. Let me briefly report to you about the current situation of the epidemic. Judging from past data, the local situation is not doing well. We have over 100 cases every day, and the number is on the rise. From the 1st and 2nd of February, we have 102 and 103 cases. To the 3rd of the month, we have 124 cases. Dr. Chang will talk to you about the 124 cases. From the beginning of January, when we had less than 10% of the ratio, now we have about 20 to 30% of cases that are unlinked. Today, the percentage is 45%. So far, we have altogether 220 cases of unlinked source. So we think that these cases involved more than a generation of transmission. From the first generation, it will be more difficult to find the source of these cases. The vertical and lateral or horizontal transmission of Omicron in buildings is very high. From the 9th of January, when we identified the first case of vertical transmission of Omicron cases, we have conducted over 20 times of investigations and actions taken in relation to vertical transmission. At the beginning of January, we have put in place social distancing measures. However, what we see recently is that in the community, say for example, shopping malls, there are more people. And we see cross-family gatherings as well. That's why after the holiday, we have seen some outbreak involving cross-family gatherings. Looking at the data, and when we compare it with the daily local case of the moving average of a 7-day, starting from the 24th of January, about 1 to 2 days, we see 100% increase. If we don't have any further measures to combat community transmission, should there be any super transmission, just like other places, Hong Kong, the number of cases in Hong Kong will increase exponentially. Given the high transmissibility among people of Omicron, as well as the risk of vertical or horizontal transmission of Omicron in buildings, here's our advice. First, we ask members of the public to observe good personal hygiene, especially that of the hands. Well, any communal place in the community is a chance of exposure to the virus. So you need to regularly wash your hands or use hand sanitizers. I will shortly ask Dr. Chen of the Infection Control Branch to give you more information about proper wearing of masks. We also ask household to put water in the U-bend of your drinks to reduce the chance of virus entering your home. But sometimes you need to also observe good hygiene in your house by cleaning regularly. Those who have not been vaccinated, please do so as soon as possible, because vaccination is an important measure to take us out of the epidemic. And I ask you all to refrain from gathering. Please reduce the number of cross-family gatherings as much as possible. If we can do that, we will have a chance to curb the transmission of the virus. If you've been to high-risk places, please get tested. If you feel unwell, please seek medical attention as soon as possible. I now give the floor to Dr. Chang. We have 131 cases yesterday. One is an imported case, 130 cases are local cases. Of the local cases, there are 3 cases carrying L452R variant, that is, suspected Delta cases. In the 3 cases, they are related to other cases, Mingli House and related cases. And 123 cases carry N501Y Omicron, and 4 cases currently being investigated into. Of the 135 cases, 9 of them are currently unlinked. 71 cases are related to other cases. Among these cases today, I can tell you information about their cases. Some are construction site workers. Of the related cases, we found that Hengping House in 2021 unit, there was, for units 20 and 21, there was an evacuation, but we've identified more cases. Some are picked up in the quarantine center, and some was picked up in the lockdown. 26 residents from 14 units have been identified. There were some gatherings. So for units 19, 40, and 42, there will be evacuation. For the 9th floor and the 10th floor, some units surround the units with an infection case. They also have to be evacuated. For Kwai Fun House, there were partial evacuation. We've identified more unit 06 closer to the top floor. So for those above the above 22nd floor, unit 06, they have to be evacuated. Of the 59 currently unlinked case, well, there are a lot of them that live in Sham Shui Po, 10 of them. In Yikuk Street, Taiwan Street, Peiho Street, Nam Cheong Estate, Ap Liu Street, Tongsheng Building, Fuk Hwa Street, Fuk Wing Street, New Reclamation Street, and Keelung Street. There are cases in other areas as well. For Discovery Bay, Area 14, as well as Midvale, there are cases. In Tong Yi Estate, Po Yat House, Yat Wo House, there are also cases. In Toka Wan, Chun Wan, Lei Mok Shu Yun, Long Chang Sha Wan, Shakip Mei, there are also cases. On the Hong Kong side, in Shang Wan, Tai Hau Hwa Ting, Block 1, and also in Grand Promenade and a number of other places. Also one case in the Ping Chau as well. They're currently unlinked cases. We've also identified some unlinked cases that involve construction site workers, some working in Fo-Tan, some in Tai Wai, some in Argyle Street, CLP projects. And in Hao Ming Street, there is a construction site, which is a redevelopment. There are 2 cases. There might be a transmission. And for the restaurant Ngau Kok in Yunnan Plaza, is a staff member. So for those who have been to that restaurant Ngau Kok, please get tested as soon as possible. So far, we have about 195 preliminary positive cases. That's my report for today.
And now Dr. Lau will talk about the HA situation. As of today 9 a.m., for the past 24 hours, the hospital authority have recorded 163 reported cases. In the past 24 hours, we have additional 36 patients discharged. Currently, about 12,916 patients recovered and discharged. Currently, we have 1,408 patients scattered across North Lantau Hospital Infection Control Center, Hospital Authority Infection Center, Asia World Expo Community Treatment Facility, and 13 public hospitals. For case number 13400, currently is still in a critical condition. The other patients are still in a stable condition. And we'd like to talk about the cases among the HA employees. Due to the severity of the epidemic, some public hospitals have reported preliminary confirmed cases due to family and community exposure. In United Christian Hospital, we have a patient care attendant and Heaven of Hope and patient care attendant. In Children's Hospital, one phlebotomist, and in Princess Margaret Hospital, a cleaning operation assistant and a hospital ward cleaner, and Ming Oi, one nurse. In Ying Chai Hospital, a contract staff responsible for transporting goods. And Ching San Hospital, we have one clerk that are either confirmed or preliminary diagnosed. They're now being arranged treatment. The hospital infection control team have conducted contact tracing, and during work they have all wear suitable personal protection equipment, and the hospitals in question have been disinfected, and no patients has been classified as close contact from this. As some of our colleagues had took off their masks to chat with their other colleagues and sat down for a meal with them. Altogether, 16 staff are classified as close contact and will be sent to quarantine. We have arranged COVID-19 testing for them, and so far the results turn out negative. And in the Children's Hospital, report a notification from the CHP, and 7-month-old baby who went to a nutritional consultation, case number 14361, was diagnosed with her mother. After contact tracing, we found a nutritionist and one patient care attendant did not wear an eye protection equipment during consultation and classified as a close contact and will be sent to quarantine. And no other patients or staff were classified as close contact. Once again, I would like to remind our colleagues, with the epidemic situation and plenty of transmission in the community, when seeing patients, they must take on suitable precautions by wearing the right PPE. And I hope their colleagues can minimize social interactions and refrain from attending cross-family gatherings and refrain from having meals with their colleagues. And we noticed recently there are some cases in residential homes. Worry that there will be more cluster cases and even bring these cases into residential homes and hospitals, which will lead to large-scale outbreaks. Once again, I appeal to the public that they should get vaccinated as soon as possible. And for those who had 2 shots, they should arrange for administer a booster shot. When you go to high-risk places, you should wear tight-fitting masks or wear 2 masks for additional protection. And Dr. Chen Hong would like to talk about wearing a mask properly. Good afternoon. I would like to talk to you how to wear the right surgical mask to minimize infection from COVID-19. Well, currently, we are having the Omicron local transmission, and this is highly transmissible. That's why we have to wear a more tight-fitting mask that's most suitable for you. First, we need to choose a mask that is well-fitting, that can cover your nose, mouth, and chin. While it's close to your face, there should be a metal strip that we should press it against the nose bridge. And we don't want to have any air leaked from the sides of the mask. But when we breathe, you can see there's hot air coming out from the mask, and there's no leakage from the corners, and we also should notice some slight movement in your mask while breathing. If you're not wearing the mask properly, then you're not able to protect yourself and those around you. Sometimes we see a nose coming out of the mask, or even the mouth, or talking without their mask, or even wear the mask on the chin to eat or drink. And how do we make our mask fits better? For example, at the ear loops of the mask, you can knot and tuck them so that they can fit more closely, and the unneeded material can be folded and tucked away under the edges. And that's what it should look like. And that's what it looks like on the sideways. By this way, you can make the mask fit tighter. And if not, you can use some assistant devices, or on top of the surgical mask, you can put on a cloth mask. There are different assistant devices. For example, these are this strap or clip that can put it behind your ears. And there are also a mask fitter, or even wear an additional cloth mask. Well, we should always try this at home first. And also make sure that your breathing and your vision are not obstructed. And there are no other safety concerns as well. Once you wear a closed mask, and that's what it looked like, and thank you all. We're now open for the questions. Please put up your hand and speak through the microphone. Before you ask, please state the media you're representing. Well, due to time constraints, and you can ask a maximum 3 questions. The last row. Good afternoon, Now News. Let's like to follow up on the Heng Ping House situation. Just now you mentioned some of the residents had some gatherings. Can you tell us what were these gatherings and how many units were involved? For that building, how many floors, or which are the units, and how many residents are confirmed cases? And do you think that there will be, this is a replay of a question, is there and require a lockdown for a week? And we'd like to ask the hospital authority about the infection situation. Just now it was reported that different staff at different hospitals were infected. And how do you assess the risk of an outbreak in hospitals? Just now it was mentioned that some of the masks might not wear their goggles properly before interacting with patients. For those personnel that need to interact with the patients, they need to improve their PPE. For example, should they resort to N95 respirator and wear safety goggles? And do you need to improve the PPE due to the Omicron outbreak? And for the construction sites, are those mainly unlinked cases, or do you see an outbreak in different construction sites?
Well, I'll talk about the situation of Heng Ping House in Tai Hing Estate, and I will defer to my colleague to talk about the construction site. For Heng Ping House, Tai Hing Estate, we have identified previous cases. Well, we identified transmission between 2 floors, so there was evacuation. Afterwards, there was a lockdown, and we've identified more cases. I'll defer to Dr. Chang. I wasn't talking about people gathering. I was talking about a cluster of units. So, from the first case to now, there are 14 units that are affected, involving 26 people. So, for units 20 and 21, there was an evacuation. Now we see a cluster of unit 19 and 42. So for those living in these 2 units, they will have to evacuate. For the 10th and the 9th floor, for units of a smaller number, that is between 13 and 24, there are also some units that are affected. We ask unit 13 to 24 on 9th and 10th floor to be evacuated. Oh, sorry, I still have something to say. For construction workers, currently there are mostly unlinked cases. For How Ming Street, there are 2 cases. For the rest, we need to make some comparison to see if they're related to previous cases. We need time. For every staff members going to work in a hospital or taking care of patients, we conduct risk assessment depending on the nature of the work and whether high-risk procedures are involved. We arrange for proper PPEs, personal protective equipment for them. Just now I mentioned that there are 2 staff members who took care of a 7-month baby. The baby wasn't wearing a mask, so the 2 staff members will have to wear goggles or face shield to prevent water droplets. But they did not wear such protective equipment. That's why they're classified as close contacts. And we've told our colleagues that for different procedures, they should wear appropriate equipment. We will provide the equipment to them. So they must put on the equipment we provide them. They need to be properly trained to know when to wear them and how to carefully take them off. For patients, for every admission there will be a screening. We will at least test them once to see if it is COVID positive. If it is, then there will be immediate isolation and treatment. The objective is not to bring cases from outside the hospital into the hospital, especially those that are asymptomatic. We don't want an outbreak. Staff members of the HA are also members of the public. They live in the community. There is always a risk of infection. When they go to work, we provide them with proper PPE. They need to wear them properly to protect patients as well. We have various measures in place to prevent cases coming in from the community and to prevent an outbreak within the hospital. The reporter in the middle. I'm from cable TV. Just now I heard that there are a number of streets in Sham Shui Po with different cases. A number of them are unlinked cases. What about their whereabouts? And what do you do with these cases of an unknown source? Will there be large-scale lockdown? For consecutive number of days, there are lockdowns and compulsory testing for buildings and areas. People said that the waiting time is very long. How do you resolve that problem? Will there be more testing stations? Is it because of a lack of manpower or a saturation in the testing capacity in Hong Kong? I'll defer to Dr. Chong about Sham Shui Po, and then I will supplement about lockdown, treatment, etc. For cases in Sham Shui Po, they are currently of an unknown source, but they do not concentrate in certain areas or buildings. We will look at these cases to see if there is any linkage. Say, for example, if they know one another, if they've seen one another. About the pressure on our testing capacity. There are different cases in different areas or districts. There are cases within a building and within certain districts. At high-risk places, we will increase the number of mobile testing stations to reduce the waiting time. We think that the number of cases will continue to climb, so we will continue to increase our testing capacity to meet the additional needs generated by an increasing number of cases. For testing of sewage, if we can focus our effort to find certain areas, then we will distribute rapid antigen test, that is, those testing kits for residents to do the test themselves. But there are limitations, so we need to strike a balance between the limitations of the testing kits and the testing capacity of the mobile stations. But in the future, we will enhance our testing capacity to meet additional need. The gentleman at the back. I'm from Phoenix TV. I'd like to ask about Hing Ping House, Tai Hing Estate, Tuen Mun. There are about a dozen cases that are confirmed or preliminary positive. You now extend the lockdown by 1 day. Judging by Ha Kwai House, and there were about 10 cases when there was a lockdown of 5 days. How come there is a difference in the criteria? Just now, Dr. Choi said that there is more than one generation of transmission, so it's very difficult to find the hidden transmission. So are you going to surrender, or are you still going to work on finding the source? You talk about rapid antigen test. Is there any chance that it will be done universally? In Sham Shui Po, any need for large-scale testing? Let me first talk about work in Hing Ping House, Tai Hing Estate, and the difference between that and Yak Kwai House in Kwai Chung Estate, as well as our current strategy. For Hing Ping House, Tai Hing Estate, we have conducted 2 investigations. First, we identified vertical transmission. That's why there was an evacuation. Afterwards, we followed up to see if there are other infection cases. We still identified a vertical transmission case, so there will be another investigation conducted. We believe that afterwards, certain high-risk residents would have left their unit, so we will conduct another evening of testing to see if we can identify more negative cases. If that is the case, that means it's under control. There is a big difference between the 2 buildings. For Yak Kwai House, there was no obvious vertical transmission. It was a large-scale transmission. For Hing Ping House, we suspect that there will be transmission between floors. That's our focus of investigation. In relation to our strategy, the challenge we face at the moment is that there are multiple hidden transmissions. We've identified these transmissions, but it will be difficult to find the source. Still, we need to adopt a containment strategy. We need to ensure that our healthcare system will not be inundated because of an increasing number of cases. We hope that we can increase vaccination rate before we can see any change. So currently, we still adopt the containment strategy to buy us some time before we can have a higher vaccination rate. Of course, we will increase our capacity of testing. We will also make use of the rapid antigen test. We will focus our efforts on high-risk areas for lockdown or testing. I will now defer to my colleague.
So far, nothing to add for the Sham Shui Po situation. Like I said, so far is fairly diffusive. While the addresses are in Sham Shui Po, but scattered on different streets instead of the same building and so on. We will investigate if these persons are linked, so we will do it first. Next, on the last row, on the first row, the lady in front.
The first is for Dr. Choi. Like close to half local cases are untraceable. How worrying is the situation? Is it getting out of control? And also for Sham Shui Po, will we see a major outbreak like we saw in Kwai Chung? And do you mean that Hing Ping House would not be another Yak Kwai House? Thank you.
Okay, so thanks for that. So I think I would like Dr. Zhang to explain to you about the Hing Ping House, the situation Hing Ping House in Sham Shui Po. And for the current situation, I think is quite challenging. because there are more and more local cases we detected every day, and those without a obvious source, the percentage has been increasing quite rapidly. From previously, there are about less than 10% of unknown source amongst the total number of cases every day, now rise to about 45%. So it's quite worrying. So what we have to do now is to, first of all, to advise, to appeal to member publics to reduce the social gatherings. And also we have to set up our testing capacity, trying to target for those high-risk area and pick up those cases. And I think with further enhance our social distancing measures, we hope we can slow down the transmissions and buy some time for us to pick up case in the future.
For the Heng Ping Lao, previously we found some possible vertical transmission. So in the 20 and 21 units, so remove the residents from the 20 and 21 units from the bottom to the top, so from the second to the 29th floor. Subsequently, we still monitor the situation, and now we know that a total of 14 units, including some units that have been quarantined and found subsequently confirmed cases. And then there's a total 26 residents in these 14 units. And we found there were some clustering around the 19th unit and 42 unit. So we need to remove residents from these two units as well. And also on the 9th and 10th floor, there's also some clustering. So we'll remove unit 13 to 24 of 9th to 10th floor because they are on the same side of the building. So we try to, we observe that there are some vertical and horizontal transmission in this building. Some Shui Po, we have quite a number of cases with unlinked at the moment. They're residing in various places in Some Shui Po. So we are checking whether they have known contact with each other.
下一位，呢邊最後一行。
Next question. TV News. Just to follow up on the construction site, which construction site you're referring to at How Ming Street, and how many construction companies are involved? And you mentioned there may be potential outbreak in residential homes. For the On Yum residential home, and any elderly residents confirmed or preliminary confirmed, and just reported that Jeff Leung, Deputy Labor Commissioner, was confirmed. Where could be the source of transmission? And for the environmental samples on the Harbour building, and whether his colleagues should be tested. I'd like to talk about the construction site and the residential home. For the construction site, we have 2 cases reported at the redevelopment site in How Ming Street. The address is number 98, How Ming Street. For the Lambu home for the elderly, at the AWE Quarantine Center, I forgot whether the elderly resident was preliminary confirmed or confirmed cases. And there is a preliminary positive cases at a worker of the elderly home at the Ma Hang Cho Road, Tokwa 1, Hong Lok Yun, and home for the elderly. And there are about 60 or 70 elderly close contacts that need to be quarantined. We not supplement on individual cases. Well, you can see there are cases in different sectors and parts of the community. The lady in the last row. Commercial radio. I'd like to follow up on the Tai Hing Estate. And the first cases was discovered on 24th of January. Can you explain about the transmission and how did it occur? Just now it was mentioned that plenty of units would need to be evacuated. Do you need to evacuate the whole building now? As compared to Kwai Chung Estate, where they have a lockdown for 5 days to allow adequate preparation for the residents. Another question for hospital authority: will the HA predict and how we can cope with any large-scale outbreak, as you have quite a number of employees infected? Do you have enough manpower to deal with the fifth wave? And for the untraceable cases, can you tell us which of them belong to Delta and which of them belong to the Omicron variant? Let me hand over to Dr. Lau to talk about the HA, then Dr. Chung to talk about the Hing House and the cases categorization. We're now proactively opening more beds. We have our first-tier beds, about 1,200 of those. And in the infection control center, we also have beds available. At the AWE, we have 1,000 beds. Currently, we will open some second-tier beds, which total at around 600. Altogether, there are about 3,000 beds, which we hope that we can admit the COVID patients. Well, with so many beds, we need medical personnel to take care of the patients. In terms of the provision of public health care, there will be some changes for non-emergency services. They will be postponed. For example, elective surgery, outpatients clinics, and day hospitals. We try to minimize the impact to patients, as some of the patients waited so long for their surgery and were in need of treatment. We hope to prepare an offerings, including beds and manpower. In terms of service, when necessary, if there will be any impact, we'll try to minimize it. I hope that the public can be understanding if for any potential impact to the fifth wave. Hopefully we can catch up in the future. At this moment, we need to write this out together. For the Tai Hing Estate Hing Ping House, we noticed residents of the 14 units were affected with confirmed cases. They clustered around Unit 20 and 21, or Unit 19 and 42. And on the 9th floor and the 10th floor, quite a number of units are clustered. Therefore, for the suspected horizontal or vertical transmission spread, residents will evacuate them. For the untraceable cases, we suspect them to be Omicron. And for the 3 Delta cases today, well, they are suspected to be Delta, and 4 of them are still pending. They are linked to other cases. Cumulatively, we have over 210 untraceable cases, and 20 of which are suspected to be Delta.
The lady over there, I'm from Tai Kung Bao. I have 2 questions. Do we still have those makeshift hospital facilities available that can be used within a very short time? And if patients have to stay home for isolation and possibly treatment, is it possible, and how do we do it? So, in relation to possible home quarantine facilities, I will give you more information afterwards. Well, for the facilities, we house COVID patients. They are the 4 halls in Asia World Expo. There are about 1,000 cubicles. We also have the North Lantau Hospital Hong Kong Infection Control Center. We have about 800 beds there. And in major hospitals, we have another 1,200 Tier 1 beds. We're now actively considering about Tier 2 beds, about 600 or so of them. We have in mind for these facilities to receive confirmed cases. A lot of the patients we have now are either asymptomatic or with a minor symptom. We have adjusted our discharge criteria. We hope that more patients can be discharged in a safe way so that we can release the capacity for those in need. We hope that we will be able to maintain hospital services, say for example surgical services and procedures that have to be done inside a hospital. We try to keep them. Currently, we are able to, but the situation is not optimistic. So, we need to draft in more and more staff members to take care of COVID patients. So in the future, non-essential services might be affected. We ask for your understanding and your acceptance. In relation to isolation in a home setting, close contacts, including family members, are required to go to Penny's Bay Quarantine Center or quarantine hotels. But if we have an increasing number of cases that we can't catch up, then we may need to find alternative quarantine facilities. One possible option is for low-risk patients that can be isolated at home. This is not something new. Say under 599C for those who come back from outside Hong Kong. Certain persons arriving at Hong Kong, they are quarantined at home. And at the beginning, we also did that. Well, we have accumulated some experience after 2 years, so we now know better about an efficient way for people to be quarantined or isolated at home. So in the future, we might go along this line, but that depends on the number of cases. Well, that is a possibility. The lady in blue, I'm from Oriental Daily News. Just now, Dr. Chang gave us a presentation about proper wearing of masks. But we're into the 3rd year of the epidemic. Why now? And is it the case that you've seen a lot of people not wearing the mask properly? That's why you want to remind them? Let me answer first. We've always thought that proper wearing of masks is of utmost importance at the beginning of the epidemic. It's not at this point that we think it's important. But we have reached a point when we see the transmission of Omicron being higher than previous outbreaks. We have identified vertical transmission, and the transmission was more efficient than previous cases. So for protective barrier is hand hygiene, personal hygiene, as well as masks. We see that some people don't wear their mask properly in a public place, as you can see the way they wear their mask from the photos. When we have multiple hidden transmissions, we think that we need to remind members of the public to wear the masks properly and choose masks with a good fit. So we need to remind them a number of things: wearing of masks, hand hygiene, personal hygiene, home hygiene, and put water in your U-bend. Let's see if we need to hear from Dr. Chen. I think the controller has said it all. It's very important to find a mask that is a good fit and observe good hand hygiene and personal hygiene. Let's hear from the last reporter. I'm from Hong Kong 01. I'd like to ask Dr. Choi. We see about 200 cases that are unlinked So is the containment strategy still effective? Just now you said that if there is an increasing number of cases, there may be home quarantine. So what is the circumstance when home quarantine is warranted? How do you prevent people from leaving without permission? I'd like to also ask about cases. Yesterday there was 160 preliminary cases, and today's number is not as high. Is it because you don't have the capacity to test as quickly as the samples come in? For Kwai Fun House, there was previously an evacuation. Now there is another one. Would you consider evacuating the entire block or locking down of the entire block for compulsory testing? I'll first ask Dr. Chang to talk about the cases. Afterwards, I will answer about our containment strategy. Yesterday, when I left my office, it was about 3 or 4 o'clock. There were 160 preliminary positive cases. They involved private laboratories, and the samples had to be sent to our public laboratory for confirmation. Sometimes the samples arrive late, or the samples have yet to arrive, and that's why they are not confirmed cases. We will continue to process the samples. You might focus on the number of cases with an unknown source, but that doesn't have a direct correlation with whether we continue with our containment strategy. Say today, for example, there are about 50 cases or so that are linked. So there is always a percentage of linked cases. For our containment strategy, apart from trying to identify the source and try to contain it at source, we also want to quarantine close contacts as soon as possible. That's also part of our containment strategy. As we said, we have to continue with the containment strategy in order to buy time to wait for the vaccination rate of our concern of a particular group to reach the rate we would like to see. Currently, we have sufficient capacity, but we need to take into consideration about the next stage. When the number of cases has reached a certain level, we will need to consider where patients can receive their treatment in a hospital. So in the future, there is a possibility that some close contacts might be quarantined in a home setting. Our approach will be similar to what we've done previously. Say, for example, the wearing of smart wristband to stop them from leaving without permission. We'll also put in support service in the form of, say, delivery of meals and testing.
The last question in the last row. Mingpao Daily News. A question for HA. And about 10 hospital authority staff were infected together with those sent to quarantine. Will this affect services? And for the pandemic situation, and some cases in Tai Hing Estate are linked to the Kwai Chung Estate, what are their linkages? And for the 50-year-old case number 13243, on 21st of January, he visited Hing Ping House. What was he doing there? Was he the one who led to the outbreak in Tai Hing Street? And for the Fortune Center, and how many preliminary positive cases? And can you speculate on the cause of the outbreak? And for those 2 persons on reconnaissance paper, can you identify them? 1 person turned in today with the staff classified in close contacts. And for the Muslim Center, can you identify all the attendees and any new cases from that cluster? And I'd like Dr. talk about HA, and Dr. Chung will talk about Tai Hing and Fortune Center and those 2 individuals on reconnaissance papers. So far, we have 30 or 40 colleagues, including those infected or their close contacts. Well, that is not too big a number. Therefore, the service is not too disrupted. We'll monitor the situation and deploy staff to minimize the service impact. Well, each colleague will need to cover for their colleague and try to provide the best service to patients. And we'd like to once again remind our colleagues, and now that the pandemic is quite severe with lots of hidden transmission train and linked cases, I hope our colleagues should avoid social activities and refrain from attending cross-family gatherings and avoid having meals with colleagues, and should wear the right PPE at work. I need to look at it. These are the related cases that start at the Hingbing House, for example, like having meals which started their transmission. For the 2 persons on reconnaissance papers, we have found them. For the Muslim worshiping place, we are still contacting no new cases so far. That's the end of the press conference. Thank you.